It's very interesting. Okay, everybody ready?
I think we're ready.
Ready? Okay. Oh, well, maybe we'll let him get a seat. The hearing will come to order. I want to welcome the Committee on the Budget to the hearing of failures of fiscal management. Today we will hear testimony from the Comptroller General of the United States, the Honorable Jean Dodaro. I want to welcome everybody back today. As I'm sure everyone is aware, we will be introducing the fiscal year 2018 budget later this spring, and the challenges we face are enormous. Deficits are set to start rising again. Many government programs are in dire need of reform, and our economy is being held back by the policies of the previous administration. And while these problems are daunting, we are elected by our constituents to make the hard decisions and confront the challenges head on. And that's exactly what we plan to do in this year's House Budget Committee. That is also why we're having this hearing today on the failures of fiscal management, and it is so important and so timely to what we are called to do. We need to do better to understand how the federal government is failing to effectively manage taxpayer dollars and how that's affecting our long-term fiscal solvency. I'm happy to welcome our witness today, the Honorable Jean L. Dodaro. He is the Comptroller General of the United States and the Director of the Government Accountability Office. The GAO possesses a wealth of information about the government's fiscal condition and the operation of its programs. Three areas we plan to examine today are the disturbing rise of improper payments by the government agencies, the programs GAO considers as high risk for waste, fraud, and abuse and mismanagement, and the government's long-term fiscal outlook, which, as all of you are aware, is not good. Mr. Dodaro, thank you for taking your time out of your busy schedule to be here with us today. The committee is looking forward to your testimony. But before we build solutions, we need to understand the core of the problem, and Mr. Dodaro's testimony will be vital to that. First are the improper payments made by the federal government. Improper payments are defined as any government payment that was made in an incorrect amount to the wrong individual or entity or for the wrong person. For example, an improper payment would be an unemployment check going to a person who has already returned to work. According to the GAO, improper payments surged to $144 billion in just 2016. That is a 35% increase from the $107 billion in 2012. This is a problem that's government-wide, including 112 programs across 22 agencies. Even worse, those numbers probably underestimate the extent of the problem, since 18 government programs deemed susceptible to improper payments did not even submit error estimates last year. $144 billion is the minimum of the problem, not the max. Second, we want to examine the government's high-risk programs. Every 2 years, GAO publishes an update list of programs that it considers especially vulnerable to waste, fraud, abuse, and mismanagement. This year, GAO identified 34 programs that match this description. The programs that demand further review are Medicare, Medicaid, federal disability programs, pension benefit guarantee corporation insurance programs, and the National Flood Insurance Program and Veterans Health Care. Third, we want to focus on our long-term fiscal outlook. In January, GAO released a report examining government spending, revenues, deficits, and debt. The conclusion was all too familiar. Our fiscal path is unsustainable, and if we fail to get control of debt and deficits, we're putting our country at risk of a fiscal and economic crisis. GAO's simulation shows our debt to GDP ratio would pass its all-time historical high of 106% in the next 15 to 20 years, and that Social Security disability insurance, the Medicare Hospital Insurance Trust Fund, and the Social Security Old Age and Survivors Trust Funds will be depleted and therefore forced to pay reduced benefits. A failure to solve these problems means seniors who have worked their whole lives and those truly in need of help can no longer count on these vital safety net programs. Improper payments, high-risk programs, and our growing debt all pose an enormous challenge, and we need to take real, tangible steps to reduce the amount of money that's being wasted to help our fiscal house in order. Mr. Dodaro, once again, thank you for being here. I know you and your staff have worked very hard to prepare for this hearing today, and thank you for taking your job as a government watchdog so seriously. I look forward to hearing your testimony and your recommendations on how we can all be better stewards of the taxpayer dollars. And thank you for that. And I now yield to the ranking member, Mr. Yarmuth.
Thank you, Madam Chairman, and thank you, Mr. Dodaro, for being here today to give us your views on the country's fiscal challenges and on the important work that GAO performs to ensure that the federal government is held accountable and continues to improve its performance. We all agree that we should look for ways to make government agencies and programs more efficient, and I look forward to hearing your views on these issues. This hearing is titled Failures of Fiscal Management. I certainly agree with the chairman that we need to be doing all we can to root out improper payments and ineffective programs. In fact, I would argue that this should be a greater priority for Democrats because of the important value we believe government plays in the lives of the American people. This is certainly a reasonable hearing to have. It's a reasonable topic, but we are in a situation that is anything but reasonable. Yesterday, President Trump called for a shutdown of the federal government. The President of the United States stated that, quote, "Our country needs a good shutdown." No, our country needs a responsible president, one who understands you don't begin the 2018 budget negotiations by threatening the economic security of our nation. This administration is already off to a rocky start. Their initial budget failed to include any information on revenues and well more than half of federal spending. The only detail provided called for severe cuts to discretionary investments that the American people need and deserve. That was followed by a plan to enact deficit-busting tax cuts for the rich that the American people overwhelmingly oppose. And then there's a plan to repeal the Affordable Care Act that has failed 3 times and counting. After a 4-month delay requested by the Trump administration, which put important new programs on hold, postponed contracts, and impeded the work of our federal agencies, we are just now passing an FY 2017 Omnibus Appropriations Bill. That's for the fiscal year that started 7 months ago. We can now move to the FY 18 budget, which brings me back to President Trump and his comments yesterday. I come back to that because it's so important to the credibility of every member of this committee, as well as our colleagues on the Appropriations Committee. Calling for a shutdown of the federal government is irresponsible and reckless. The last shutdown took billions of dollars out of the economy and was entirely avoidable. As members of the House Budget Committee, it is our job to craft a congressional budget, a budget for our nation. It is our responsibility to treat this process seriously in a way that respects the gravity of the decisions made by this committee, regardless of whether we agree or disagree on priorities or policy. We have a responsibility to protect the seriousness of the work we are charged with, and this must include condemning reckless calls for shutting down the federal government. On this, we need to speak as a unified voice. So I ask my colleagues on the other side of the aisle, when are you going to say something? When are you going to push back against these statements by President Trump that threaten our economic and national security, that erode even further the American people's confidence in our government? Please find that courage. We can't let these statements go unchecked any longer. As members of the Budget Committee, we must be a stabilizing force in these debates. With that, I once again welcome you, Mr. Dodaro. Look forward to your testimony, and I yield back.
Thank you, Mr. Yarmouth. And in the interest of time, if any other members have opening statements, I ask that you submit them for the record. I would now like to recognize the Comptroller General of the United States, the Honorable Jean Dodaro. Mr. Dodaro, thank you again for your time today. The committee has received your written statement, and it will be made part of the formal hearing. You have 5 minutes to deliver your oral remarks, and you may begin when you are ready.
Thank you very much, Madam Chairman, Ranking Member Yarmouth, members of the committee. I'm very pleased to be here today to discuss GAO's work related to the fiscal health of the federal government. In January, we issued a report outlining our views on the current fiscal condition of the federal government and its outlook for the future. In that report, we recognized that the Congress and the country face a number of serious economic, security, and social issues and need to make short-term investment decisions and difficult policy options to be considered. But we also underscore the fact that the Congress and the administration face a situation where the government is heavily leveraged in debt by historic norms and, in our view, on an unsustainable fiscal path. The deficit for 2016 rose to $580 billion. It's the first time in the last 6 years the annual deficit rose. That took the cumulative debt held by the public as a percent of gross domestic product from 74% to 77%. Now that compares to an average since 1946 of 44%. So we're much more indebted than by the historical averages as a percent of gross domestic product. If you look into the future, our projections, the projections of Treasury and OMB and CBO all show that the federal government, absent a fiscal change in policies, would exceed the historic average of debt to GDP ratio of over 106% that occurred during World War II. And it would keep rising in the out years to 200% and beyond. So something has to change. The key drivers here are healthcare costs, the rapid growth in Medicare and Medicaid programs. Healthcare costs are still growing faster than the economy, and demographic changes are adding additional people to the rolls as our population ages and as people's lifespans extend. Also, interest on the debt is another long-term driver. In 2016, we paid over $250 billion in just the interest to service the debt. Interest rate costs are going to rise, and if we continue to add to the debt combined with interest rates accruing, that's going to be a key driver in driving this deficit up much further. Compound interest is great when you're saving, but it's not so good when you're borrowing. And that's the position, unfortunately, that we're in. Now, in order to resolve these problems, I believe the Congress needs to pass a plan to deal with these long-term situations. The sooner we take action, the better, so people can adjust, because you're going to have to grapple with the entitlement programs, discretionary spending, and the revenue side of the government. So it would introduce a number of changes, and the sooner action is taken, the easier it will be to introduce these changes and give people time to adjust. Now, that plan, while solving this problem requires these difficult fiscal policy decisions, there are other things that could be done to help make the government more efficient and effective. You mentioned, Madam Chairman, in your opening statements, improper payments. Since the Congress required improper payments to be estimated by federal departments and agencies and reported to the Congress in 2003, the estimated number of improper payments reported has exceeded $1.2 trillion. In the last few years, as you mentioned, the last 3 years, it's gone from $125 billion to $137 to now $144 billion. And so this situation requires the attention and focus. We have many recommendations for how it could be handled. The figure is an underestimated figure because, as you mentioned, 18 major federal programs did not report improper payment estimates in 2016, including the Temporary Assistance for Needy Family Program and the Supplemental Nutritional Assistance Program, both large programs. So the number is much larger, and a number of things could be done. We also have recommendations about almost 400 recommendations where tens of billions of dollars could be saved by eliminating overlap, duplication, fragmentation, taking other cost savings options to deal with these issues. So I look forward to working with this committee. I appreciate this hearing today so that we could discuss GAO's work. I believe it can help the Congress deal and grapple with these very important issues to the future of our country. Thank you very much for the opportunity. I look forward to answering questions.
Wow, you were right on the dot there. I would expect nothing less from the Comptroller General to be right on the dot when it comes to numbers. Again, we so much appreciate your being here and the work that you and all of the folks in your office have done. I don't disagree at all that we have to have a better plan, and we haven't done as good a job as we need to do with controlling many of those costs, including the growing interest, which you have already indicated is a big part of our expenses and will only grow if we don't get cost controlled on the other side. But let me go to the government-wide improper payments, as has already been said in my comments, and again with you, that it totaled $144 billion. And I don't know, when we talk about millions and billions and trillions of dollars around here, it's almost like Monopoly game, but this is real money. $144 billion, I think about what could be done with that money instead of being an improper payment that goes out the door, and we don't really have a good way of retrieving that. But you also said this may be an understated problem. So some of 18 government programs did not even report the estimate for their improper payments last year. Does this suggest that the problem of improper payments is even larger than what you're reporting? In other words, might $144 billion really just be a floor rather than a ceiling? And if you could give us some kind of even just ballpark, I know that's difficult to be done, but just kind of a ballpark of where that difference may be.
First, it's definitely an underestimate of what the total scope of the problem is. Every year when we issue our statement on our audit of the federal government's financial statements, we list as a material weakness that the federal government is unable to report the full extent of the improper payment problem, and thus is not in a position to effectively manage the results of those programs. When we first started doing our audits of the federal government financial statements, and those audits weren't required by the Congress until 1996. So we went for 200 years in this country without the discipline of annual financial statement preparation and audit like occurs in the private sector and, of course, at the state and local level. The auditors estimated the improper payment estimates, and finally the Congress passed a law requiring the management of the departments and agencies to do this. Yeah, unfortunately, I can't give you a figure on what I think the total would be, but I think it to be materially understated at this point, which would lead to additional billions of dollars. I know for a fact when the Supplemental Nutrition Assistance Program did report improper payments, their improper payments were over $3 billion. So when they start resuming making their estimates, I expect it to be, so it's billions of dollars understated. The problem's pervasive, as you mentioned. It's 112 programs in 22 different agencies. The biggest three, though, are Medicare, it's about $60 billion, Medicaid, $36 billion, and I believe Medicaid to be understated because it doesn't significantly focus on the managed care portion of Medicaid yet, and the earned income tax credit, which is close to $17 billion for 2016.
Could I ask to have figure number one, slide number one, put up on the charts? And if we can just refer to this, over the past 5 years, the GAO has made nearly 130 program-specific recommendations to various agencies to reduce those improper payments that have not been adopted or implemented. And so we see the dollars go out the door, you make recommendations, they're not adopted, they're not implemented. Can you give us some kind of an idea about why that is? Is this a case of the agency just not wanting to do it? Are there other barriers at play that prevent the agencies from acting on the GAO recommendations?
Yeah, there's a couple of factors. One, I believe this is a cultural shift. Most of the programs in the agencies believe their job is to make sure they don't miss anybody that should be paid. And so as a result, the tendency is to, when in doubt, pay and then worry about it later. And we're trying to shift that culture to making sure there are not payments made inappropriately in the first situation. 90%, over 90% of these figures are overpayments. Now, some of them are underpayments, which is a problem too, because that means somebody who should be getting the money isn't. But the big problem is overpayments. There's not enough checking before the payments are made up front in the first place. We have a recommendation to the Congress, for example, to match against the complete Social Security death master file to make sure people aren't taking advantage of people who died and filing false claims. This has been a problem. We've identified this, the IGs and others in the past. But it will take a requirement, a change, amendment to the Social Security Act in order to allow Social Security to share that full death master file with the agencies. I've also been working with the state auditors, particularly as it relates to Medicaid, because in some states, Medicaid's a third or more of the entire state budget, to get the state auditors involved. This may require help from the Congress in order to provide some funding, which I think would have a good return on investment there as well. The other thing is, I think there needs to be greater congressional oversight. There are at least 7 agencies that are out of compliance with the law. The law says you got to keep your improper payment rates below 10%. There are 14 agencies, I believe, or maybe 11, that are above 10%, and some are extraordinarily high. And if you're out of compliance with that for 3 straight years, you're out of compliance with the law. And they're required, the agencies are required to submit to Congress proposed legislative changes to bring them into compliance with the law. But there needs to be more oversight by the Congress and attention made to these areas. And we have a number of other open recommendations that I list in my written testimony for specific areas and programs. In other areas in Medicare, for example, we've recommended that the CMS seek the authority to allow recovery auditors to do audit before the payments are made in the first place. They did a pilot, it was demonstrated successful, but they haven't yet submitted that legislative proposal to the Congress. So there's much can be done.
Well, and I appreciate that, because once the dollars are out the door, they're very hard to get back. But as you've indicated, there's got to be some kind of consequence rather than just a good faith effort to fix it, because we see how this has continued to grow. And if there were an effort to be done where there were actually teeth behind it, consequence, some sort of a tangible penalty or sanction, that seems to me that would be a whole lot more effective than just good faith effort, because if we continue to see this grow, that is ultimately affecting the taxpayer. I know we talk about these dollars as they somehow belong to the federal government, and they don't. These are taxpayer dollars. I only have a brief period of time left, but I'm looking at the long-term fiscal outlook, and GAO has been doing its long-term simulations since 1992, about a quarter of a century. How much worse is the outlook now compared to what it was then? And is it worse now than GAO projected in 1992? So in other words, what you projected in 1992, is that true, or is it worse than what you had projected?
Yeah. I'd have to go back and double check the 92 projections, but I would believe they would show the situation now is worse, because I don't think at that time we anticipated the Great Recession that occurred during the global financial crisis, and that worsened the situation considerably. We were on an unsustainable path before the global financial crisis, but after that, when we borrowed money to help stabilize the financial institutions and resume credit lending, we had the American Recovery and Reinvestment Act to provide stimulus funding. All that added additional money, and there are a number of things that have been added over time. Part D, paying for prescription drugs without funding it, and so all those things have added to the debt. So I'll double check, compare it exactly to our 92 estimates and submit that for the record.
Thank you.
But my overall feeling is it's worse.
Well, I sure do appreciate that. And again, I appreciate you being here. I do want to highlight one of our colleagues who brought this to our attention so that we could have this most interesting and important conversation, and that's Mr. Palmer. and I know he will be here in just a bit to ask some questions, but I don't know that there's much else that's more important than our fiscal sustainability and the fact that we can say to the American people, when you send your taxpayer dollars, they're being used for their best use and that there is not a waste in that. So such an important conversation, one that I don't believe many of my other colleagues outside of this committee have any idea. And so we hope to highlight it through this hearing and other measures that we do going forward. So thank you again. Now we can begin our question and answer period, and I will turn to the ranking member, Mr. Yarmuth, for your questions.
Thank you, Madam Chairman, and once again, Mr. Dodaro, thank you for your testimony, and you and I had a very good conversation in my office several months ago. I appreciate the work that you do and that your organization does. As I said in my opening statement, I truly believe that this is something that we Democrats should be even more vigilant on than Republicans, because I accept the moniker that we are the party of government, and we ought to make sure that we do what we can to create the most efficient government possible, and that certainly when you have abusive programs that we believe in, we would be much more credible if we work to make sure that those programs were as efficient and effective as possible. So I look forward to working with you as we move forward. Chairman Black asked the question about what's responsible, and you gave some answers, but I'm wondering whether whether it's a larger problem with personnel or in the agencies, or whether it's with structural problems. Is there any way to characterize that?
Yeah, I think it's a multifaceted problem, and quite frankly, the agencies have not really identified all the root causes necessary to identify what the specific problem is. I think it's part people, it's part technology. Technology is really one of the ways to be able to do this. Part of it's legal barriers, in that there's not enough sharing of information between departments and agencies that could check. A lot of these programs are based on income requirements, and there could be more checking. Right now, it's mostly self-reporting by people about what their income levels are, so there could be more checking up front before payments are made. So it's people, it's technology, it's incentives, and it's culture.
I appreciate that, and I know the lawyers say never ask a question you don't know the answer to. I'm not a lawyer, and I'm not that disciplined, so I tend to ask questions that I could be surprised about. But I'm curious as to whether you've done any analysis of whether a lot of this ends up being a cost-shifting situation, in which if you were to actually stringently enforce all of the guidelines of these programs, whether you wouldn't shift costs onto either state and local governments or some other area of the federal government.
Yeah, the only cost shifting that we've reported on, I'm aware of, is actually the reverse. And it's in the Medicaid program, where the states are shifting more of the cost to the federal government. They have to provide a non-federal government share of their Medicaid spending, and a lot of them are taxing and using other means for local providers, and then they're making payments back to those local providers that are high, which in effect shifts the cost because it increases the federal matching requirement there. In most of these programs, the federal government bears most of the fiscal responsibility and the outcome for the program, so the responsibility really lies at the federal level. There could be incentive issues at the state and local level, particularly in the Medicaid program, where the federal government does so much matching. In the food stamp program or supplemental nutritional assistance program, it's all federal money. It's administered at the state level. So the only shifting I'm aware of is within the Medicaid program, and we've made recommendations to CMS to collect better information to prevent that cost shifting from inappropriately affecting the federal government's share.
How much of the inappropriate payments that you've analyzed are the result of criminal behavior?
It's hard to determine. Not all improper payments are fraud by a long shot, but all fraud is improper payments. And just to give you some examples, in the healthcare area alone, the Justice Department has a special task force. They had almost 900 cases that they've opened up, and the HHS Inspector General have completed over 700 criminal cases just in 2016 alone, and almost 700 civil cases as well. So it's clear there's fraud in the healthcare area in particular. The other areas in the earned income tax credit area, and we have made a number of recommendations to the Congress. In that area, you've got a very complex program with a lot of complex rules that are difficult to follow about residency and dependency of the children, movements between families. But we found, most of the earned income tax credit, people go to have their returns prepared by unenrolled tax preparers at IRS. And about a third of the overpayments are due to errors by these unenrolled tax preparers. And actually, for refundable tax credits, people who do their own taxes have a much higher accuracy rate than if they go and they use an unenrolled tax preparer. So we've recommended that the IRS have provide some certification requirements and training requirements in this area, which we think would really help reduce the error rates in the earned income tax credit. They're close to 25% of the program, and they also take up a lot of IRS's time in doing the audits. They do more audits in that than almost any other area. And they also, I've been talking with several members, Congressman Renacci and others. There's a way to give IRS more authority to correct errors when the returns are there. Congress could act to do that. That would solve part of this problem too, rather than having to have a full-blown audit to address the issues. So there's a lot of things that we've made recommendations to the Congress. One area Congress already acted on, and I'm very pleased, is they are now requiring the W-2 information by employers to be sent to IRS by the end of January. Previously it had been March and April, so IRS didn't have that information to match against returns that were filed.
All right. While we're on the subject of taxes, when you throw out the figure of $450 billion a year in uncollected but due tax revenue, that's a pretty frightening figure, because you're talking about, in some years, the entire federal deficit, essentially, and a good share of it even today. What are the key factors that we need to consider in Congress to reduce that number significantly?
Yeah. The number is an annual number. So unlike improper payments, we got money going out the door that probably shouldn't in some cases, and a lot of revenue that should be coming in that's not. We're about 84% compliance, voluntary compliance rate. We've encouraged the IRS to do more third-party reporting. If you look at where the tax gap is, about 84% of it is people who underreport their income. About 10%, 14% of it, 10% is people who have reported properly but just don't pay the tax, and then you have about 6% of people who don't file at all. And so in targeting, and you look at where the gaps are, where there's withholding at the source, like for most people, their taxes get withheld by their employer and remitted to the IRS, there's very high compliance rates. But when you get to small businesses, partnerships, and corporations and others, there's less compliance rate at those areas. So if IRS has better third-party reporting information that they compare to the tax returns that are submitted, the compliance rates go up. So we think there's more third-party reporting that could be done. We believe this correctable error authority at IRS would help a lot, not only in earned income tax credits, but in other tax returns. And also, we believe that there's giving IRS the authority to ensure that anybody who's a tax preparer is credible, well-educated, and is going to make good faith efforts to comply.
Okay, one obvious question I have, and it probably is a very simple answer, but if a lot of this is income that we don't know about, the government doesn't know about it, how do you know about it?
Yeah, well, IRS does studies. The estimates are all based upon Actually, it was a GAO recommendation years ago, and nobody knew what the size of the tax gap was. So IRS has a research effort where they use all their tools, the results of all their audits, where they found these things. They have whistleblower programs that we've recommended be streamlined, so people call them with tips all the time. So, while, we don't know, or IRS doesn't know, somebody knows, and they inform the IRS, and there are other ways for them to find out these measures. But the IRS, these are well-informed estimates by IRS.
Great, I appreciate that. Thank you for your responses, and I yield back.
Thank you, Mr. Yarmuth. And now I'll recognize the gentleman from California, Mr. McClintock, for 5 minutes.
Thank you, Madam Chairman. First of all, I'd like to correct the misrepresentation that we heard from the ranking member that the president was calling for a government shutdown. In fact, he's been bending over backwards to avoid a government shutdown. There are some on our side of the aisle who think that maybe he's gone too far in bending over backwards to avoid a government shutdown. What he called for was for the Senate to reform its cloture rule on fiscal bills that has completely gridlocked Congress's ability to control spending and to exert its power of the purse. He suggested it might end up taking a shutdown before the Senate finally realizes how serious the problem is and decides to fix it. So I want to make that clear. Mr. Dodaro, does the omnibus spending bill that's now pending before the Congress improve or degrade our government solvency?
Well, I believe the current estimate for this year by CBO, the deficit, is over $500 billion. So it's still not, we're still spending more than we're
Does the current omnibus bill make it better, worse, or keep us on the current trajectory?
I think the deficit would go up a tad. I'd have to check and go back to see.
So it would increase our debt picture even further?
Yes.
You report that revenue growth's up $18 billion, our spending's up $166.5 billion. That is certainly a prescription for disaster. It seems to me from your report that the increase in spending is all being driven by mandatory spending?
Mandatory spending, including interest on the debt. But what you're seeing now is a harbinger of what's going to happen with the demographic changes in the country and the baby boom retirement. Between now and 2029, every day in the United States, on average, 10,000 people turn 65. So we're almost going to double the number of people enrolled in Medicare and Social Security.
Well, let's go to that question for a second, because you said the debt held by the public is going to exceed our previous high of 106% of GDP in the next 15 to 20 years. But isn't our total debt, intragovernmental and debt held by the public, already approaching or exceeding that all-time record high of?
Yeah, that's correct.
And that record high occurred at the very end of World War II, when we had completely exhausted our nation's resources, fighting against the two most powerful military forces on the planet. And there was serious concern whether we could even continue the war into fiscal 46, because we were out of money.
Right.
And we're actually there right now in terms of the total amount of debt being held by the federal government, both by the public and intragovernmental debt. And isn't the distinction between debt held by the public and intergovernmental debt largely due to the government repaying loans that's taken out from the Social Security Trust Fund?
Yes.
So as it does so, it converts intragovernmental debt into public debt. Isn't that right?
That's right. That's
so
right.
Isn't this a distinction without a difference? Intragovernmental debt will automatically convert into public debt over the next few years. So really, aren't we already at that all-time limit?
Well, it's a timing issue. It's a timing issue. In fairness, what we're using the debt held by the public to compare to the current GDP ratio, and as this debt, intergovernmental debt plays out over the coming years, there'll be different GDP estimates. So it's the classic way to compare this.
Going to the issue of revenues, where do we stand right now in revenues as a percentage of our GDP as compared to our post-war average?
What? We're lower.
We're lower in revenues than our post-war
Yes.
average.
Yes.
Okay, and where are we on our spending?
Higher.
And isn't spending really the critical issue here? I mean, to me, I think there are only really two ways to pay for spending. You either tax it now as revenue, or you tax it in the future as debt. And if you tax it as debt, you end up paying interest on that debt, and you borrow from the same capital market that would otherwise be available for consumer purchases when two-thirds of economic growth is driven by consumer spending, or loans to businesses seeking to expand jobs.
Yeah, the gap, that structural problem between revenues and expenditures is so large. If you were to try to just keep the debt held by the public at the current average of GDP over the next 75 years, you'd have to, on average, cut spending 25% from current levels, on average, over the 25-year period, if you were to do spending alone. If you were to do revenue alone, it'd be 36% increase in taxes in order to generate more revenue to close this gap.
Minus the negative impact. Minus the negative impact on the economy that would suppress revenues.
Yeah, you'd have all sort of attendant factors that would cascade from those decisions. But I think the problem is so big, eventually there's going to have to be a combination of spending reductions and attendant to revenues in order to solve this problem in an equitable way.
Or revenue growth by
gentleman's-
economic
Yes,
expansion.
yes,
The gentleman's
that
time
always
has
helps.
expired.
Yeah.
The gentleman's time has expired. The gentleman from California, Mr. Carper Hall, is recognized for 5 minutes.
Thank you very much, Chairman Black and Ranking Leader Yarmuth. Thank you, Mr. Dodaro, for coming today to provide us your nonpartisan, unbiased opinion and feedback today. The CBO has told us that of the 10 largest tax expenditures, the top 1% of income earners reap 17% of the tax benefit, and some are massively favoring the wealthy. 68% of the benefit from the preferential rate on capital gains and dividends goes to just the top 1%. Others favor well-connected special interests, like the carried interest for hedge fund partners, special depreciation for corporate jets, and subsidies for big oil. Would re-examining and closing some of these loopholes and provisions be a way to improve our fiscal situation?
Yes. We have an outstanding recommendation that tax expenditures be regularly reviewed, just like the agency operations where appropriation decisions are made every year. The amount of tax expenditures in any one year of revenue foregone is over $1 trillion. So it's almost as much money as discretionary spending in many years. And we've recommended that more disclosures be made in the budget process, and that in OMB implementing the program inventories, you look at a set of programs and related tax expenditures together, because tax expenditures are another federal tool for delivering services. Programs are one, tax expenditures are another, loans are another, but a lot of them are in similar areas where you're trying to achieve multiple objectives. So regular review of tax expenditures ought to be a normal practice of our government. It has not been.
Thank you. In your report on page 21, it shows that the highest improper payments go to 4 major programs: Medicare fee-for-service, Medicare Advantage Part C, Medicaid, and earned income tax credits. I'm wondering if there has been a deeper dive of trying to understand the profile of who the recipients of these improper payments are.
Yes, there has been. For example, in the Medicare fee-for-service area, there's higher improper payments rates for home health services and durable medical equipment. And so there are some additional information. It's probably not everything that needs to be done eventually, but there are some indicators of where there are higher improper payment rates in place. Most of the improper payment rates in Medicaid are in the fee-for-service portion. The managed care portion now is about 40%, and that we've recommended that the state start auditing the managed care providers and the Medicaid programs and CMS has passed a rule to require that, so that'll start soon. That'll provide additional insights into the Medicare managed care portion.
Thank you. And the last observation that I wanted to share is that in 2009, the improper payment error noted in the 2016 financial report for the U.S. government noted that in 2009, the improper error rate was 5.42%. When sequestration came into effect, it was 3.53%. In 2016, it's come up to 4.67%. I only throw that observation out because it seems that there might be a correlation with sequestration. Any thoughts?
I'd find it difficult to draw that correlation myself. I think a lot of this is driven by the growth in the programs. And, Medicare and Medicaid are growing at 6 to 8% a year and projected to grow in that. So some of the increase is just by the fact that the programs are growing faster. Most of this needs to be resolved through technology, changes as well. Maybe there was some effect of the changes, but I don't think over time that's really the driver.
I was referring to the error rate, but I'm almost out of time.
Yeah.
But thank you so much.
But my answer applies to that too.
Okay, thank you very much.
Sure.
I yield back.
The gentleman yields back. I now recognize the gentleman from from Wisconsin, Mr. Grotham, for 5 minutes.
Thank you. I'm looking at the table we looked at, that you mentioned, programs reporting improper payments, and I'd like to zero in on a couple of them. Sure. One is the earned income tax credit. You show here that, shockingly, 24% of the payments are improper. And I wondered what that means, improper, or whether you're catching everything. How do they determine that 24% number?
It's based upon a statistical sample that they take of error rates later and a closer examination.
Is that error rates on the return, or is that going into somebody's house and seeing whether the child is really with them? Or is it actually, going through and seeing whether they have income that's cash off the books?
Yeah.
I mean, I hear so much evidence, especially from kind of the more liberal people in my district who, maybe administer the low-income housing. This is a broken program. I just wondered what that 24% means. How hard do we look to see?
Yeah, I believe, it's mostly through audits IRS does of the ETC program. The EITC audits account for 39% of all the audits IRS does of individual tax returns. So this is an area that's heavily audited by the IRS because of the error rate. And I'll give you a detailed answer for the record about exactly how they developed the rate, but it's a heavily audited area by IRS.
I realize it's audited, but I wonder when they audit what they pick up on. Do they go into somebody's house, and if somebody puts down, Mary Smith, Social Security number 123456789, do they confirm that Mary Smith is there? Do they go into the house and make sure that, because a lot of people make money off the books, and there's certainly a lot of evidence that people are using their earned income tax credit for things other than children's shoes. Would the audit pick up on those things, or would those be additional examples of fraud?
Yeah. I don't know offhand, and I'll give you an answer for the record on that.
Can you look into that for us? Because I have a feeling it's even higher. And, any other program, if 24% was going out the window, we'd look for a different program.
Right.
Next question I have for you is on Medicare and Medicaid. I recently talked to a guy from my district whose business includes auditing payments for companies that self-insure. And he found shockingly high overpayments. When you went out of network to an emergency room, he found, I'm reluctant to even give you the numbers because I'm afraid somebody will question them, and they're just so high it's beyond belief. But when you talk about errors in Medicare fee-for-service, again, how deep a dive are you doing that? Are you going deep in depth of the individual bills? Like if a Medicare patient goes to an emergency room, Are they really going through those bills, or how do they get at that 11% number?
Yeah, yeah. Well, in those cases, I know they take a statistical sample to claims and they ask for all the medical documentation. So sometimes they'll determine that the medical procedure charge wasn't really needed during that period of time. They'll find that there's not adequate documentation, that the doctor actually ordered the particular service. So there are a lot of different reasons. So they go through a pretty thorough job. We're going to take a look at that area. I want us to understand a little bit more about exactly what they're doing and how they're making the decisions in these estimates.
Because we found, or this guy tells me, and I put you in kind of, in excess of 30%, which is kind of scary. I don't know, obviously, you're talking when you get out of network, but kind of scary stuff. Let's see, where's our clock in this room? Oh, there it is, I can't see, okay. I'll come back to the earned income tax credit one more time. It seems to me the problem there is that it's refundable. Do you have any opinion as to what high an error rate you considered satisfactory?
Well, I think it would vary by individual program, but the Congress has already statutorily determined 10% is, if you're below 10%, you're in compliance with the law. If you're above, you're not. And I wouldn't have any reason to say that that's not a reasonable basis to start with.
Can you dig into that number and let us know whether the IRS checks into cash off the books and whether the IRS literally, because I don't even know how they'd be able to do it. I mean, you say the kids are at school, what are you going to do? Does the IRS do something to confirm that those children are genuinely with the people who are claiming the credit?
Yeah, yeah. I think they do some checks, as I'm thinking back now, in terms of checking school records, or have people give them documentation about school records and other things. So, but I'll give you a thorough answer to that. And
Thank you.
And it's an important area. And I think, our overall conclusion along the line of your questioning is the problem is bigger than what's being stated already.
The gentleman's time has expired. The gentlelady from Illinois, Ms. Schizkowski, is recognized for 5 minutes.
I want to thank you, Comptroller General, for being here today. You talked about the cost of health care, and within health care spending overall, prescription drug costs are really a driver in the growth of costs for both consumers and the federal government. Medicare Part D prescription drug costs nearly doubled from $61 billion in 2007 to $121 billion in 2014, and more since then. Prescription drug costs in Medicare Part B doubled from $11 billion in 2007 to $22 billion in 2015. So I wanted to know if you thought that, and this is by the way, an issue that the president has raised to get a handle on prescription drug costs. So do you believe that slowing the growth in prescription drug costs could help reduce health care spending and improve our long-term budget outlook?
Yes, definitely.
So the president has mentioned reforms like letting Medicare negotiate drug prices like the VA has done, and then additionally we could end anti-competitive practices in the pharmaceutical industry, promote greater transparency in drug pricing so that consumers and taxpayers can get a best deal. Do you agree that those are options?
Yes. I think now, for example, in Medicaid, you can get there's some rebates negotiated. But this is an area where you not only have Medicare and Medicaid, but you have two of the largest healthcare systems in the country, in Veterans Administration and DOD, also purchase a lot of these drugs. And so I think there's a lot of opportunities for the federal government to better leverage its purchasing power. Now, it's a complicated area and require a lot of study, but I think it's a worthwhile area to pursue.
Thank you, I agree. I wanted to ask you about the Defense Department. Years ago, I was on the Government Efficiency Subcommittee of Government Reform along with Steve Horn from
Yes.
California.
I spent many hours before that committee.
Yes, exactly. And so I remember at that time we were saying that the Department of Defense could not account for about $1 trillion at the time. of expenditures. And that number, I believe, has gone up. Am I right, the Department of Defense has never had an audit or been able to perform an audit?
No, that's exactly right. They are the only major federal agency that's never been able to pass the test of an independent audit. Right now, they're trying to audit 1 year's budget execution numbers, and they haven't been able to do that yet satisfactorily. A third of the areas on our high-risk list that the chairwoman mentioned in the beginning are DoD business practices: financial management, contract management, weapon systems acquisition, information technology management, and their business modernization efforts. I mean, we have a wonderful military. It's the best in the world, but their business practices need to be reformed.
But it is, $600 billion last year, 15% of the federal spending. So how much should we focus on that? It seems to me that the very least we should ask is for the Department of Defense to pass an audit like every other department.
I agree. I think Congress should focus more on it. The Armed Services Committees have been. They passed laws saying they should be auditable by 2017, so they're planning a full-blown audit for 2018, but they've already said that they don't believe that they're likely to pass the audit. But I think we need to keep the pressure on to impose the fiscal discipline necessary at the Defense Department.
I have little time left, but I just want to raise this issue of Social Security. In 1983, 3/4 of employee compensation in the country was subject to payroll taxes. In 2015, less than 2/3 of employee compensation was subject to payroll taxes. There's been a lot of concern about the long-term viability of Social Security. Wouldn't it raising or eliminating the cap to capture more income make sense?
The programs are in jeopardy. The disability portion is expected by 2023 to only have enough money to pay 89 cents on the dollar of promised benefits. The old age survivors portion of Social Security is expected by 2035 to only be able to pay 77 cents on the dollar. One of the options that people have suggested is raising the cap. I think that's a viable option to pursue. It depends on whether, though, if you raise the cap, whether you delink benefits. And so in other words, if people are paying more, their benefits don't go up above a certain level. If the benefits go up as a percent of what they're contributing, it won't solve as much of a problem.
Thank you. I yield back.
The gentlelady yields back. The gentleman from Michigan, Mr. Bergman, is recognized for 5 minutes.
Thank you, Madam Chairman. Comptroller General, first of all, thanks for being here today because you're painting a realistic picture, and that's what this country needs at all levels, is a realistic picture. Your written testimony shows how agencies' improper payment estimates have steadily grown every year, almost doubling over the last 8 years. Not only the total dollar amounts, but also the rate of improper payments. What factors have driven this growth, and is it a matter of examining more programs, doing the analysis more accurately, more government spending, or all of the above?
It's basically all the above. The estimates need to be better. Like we found, for example, I'll give you one good example, the TRICARE program and the DOD area. We're just talking about DOD. Their estimate does not go as deep as the Medicare estimates do, in the fact that they don't check whether the payment was made for something that was medically necessary, whereas Medicare does do that check. So the error rate in TRICARE is way low, and so we've asked them to change their methodology. A number of programs and departments don't report at all because they've assessed their risk of improper payments at not a high risk area, and so there's that needs to be examined. In other cases, there needs to be more pressure on the agencies to find the root cause of the problem and correct it and bring the error rates down so they're in compliance with the law.
So it's fair to say then that the more we look for improper payments at this point, the more we're probably going to find.
Definitely, definitely. And that accounts for some of the growth, actually, in the reported amounts and the error rates.
Well, there are 18 programs across the federal government that agencies have determined are at risk for significant improper payments, yet no estimates were reported. I chair the Veterans Affairs Committee on Oversight and Investigation Subcommittee, and 4 of those programs belong to the VA. VA has pledged to report estimates this year. Have the other agencies who are in control of those programs pledged to do the same?
The prior administration has been was focused on this area and trying to get the agencies to develop plans. I met recently with the new OMB director, Mick Mulvaney, and expressed my concern about this area and the need to focus on it within the administration. So I think it's important for this administration to focus on this important area. The agencies by law are supposed to make that pledge. They're supposed to set goals and work hard to achieve those goals and in good faith, but there needs to be more oversight within the administration, by OMB, and within the Congress.
And as you know, the VA committee, the VA Community Care has the highest improper payment rate in the federal government at almost 76%. The reason for that technically is because the community care spending is not backed up by contracts that comply with the federal acquisition regulation. There's debate about whether all those arrangements with doctors need to be contracts or something else. Once that technical cause is determined, are VA and GAO looking deeper into how much is actually paid out in the wrong amount or to the wrong person?
Yeah, we will look more carefully at that area once that issue gets resolved. I'm very concerned about the Veterans Administration. We placed them on our high-risk list back in 2015, Veterans Healthcare, because a lot of inadequate policies and procedures that were ambiguous. There's not good oversight and accountability. Their information technology systems are way outdated. The scheduling system now that's being used to schedule appointments with doctors over 30 years old, for example, and there's problems with use of resources to make sure that they're properly there's a lot of lack of clarity between their requirements and resources that are needed. So we are very focused. I've met with Secretary Shulkin about them coming up with a plan to address the high-risk areas, which would include, taking a look at these improper payment issues.
Thank you for your very direct candor, and I yield back.
The gentleman yields back. The gentleman from New York, Mr. Higgins, is recognized for 5 minutes.
Thank you, Madam Chair. So you indicate in your report that federal spending is driven disproportionately by Social Security, Medicare, and Medicaid. The stated objective of health care reform, the Affordable Care Act, Obamacare, call it what you will, was to do 2 things. One was to increase the number of people who would have health insurance, and I think that objective has been met in the aggregate by some 20 million additional. The other was to slow the growth of healthcare spending as it relates to Medicare and Medicaid. Economists would call that bending the cost curve. Your assessment as to the success of that since the enactment of the Affordable Care Act as it relates to annual increases in Medicare spending per beneficiary.
Mm-hmm. Yeah, I need to give you a technical answer for the record, but what I will say is that the trustees report, now this is the Secretary of HHS, Secretary of or Social Security Administrator, and the Secretary of Treasury, and the CMS actuary have real questions about whether or not the reforms put in place by the Affordable Care Act will hold over a period of time and actually reduce costs, both in terms of productivity, expenditures, as well as the subsequent legislation that Congress passed changing provider payments to physicians, and whether that'll hold over time. So there's real questions about it. But I'll give you a specific answer, for the record. But one of the differences between our report is estimates of whether or not healthcare costs follow this alternative path that the CMS actuary has put in place. If that happens, and these reforms don't hold over a period of time, you have much more escalating costs in the future for Medicare and Medicaid, and you get to a point where our debt grows faster as a result of that.
Okay, well, the Congressional Budget Office report that I read recently indicated that prior to the Affordable Care Act, Medicare was growing at between 7 and 9.5% a year. And since the full enactment of the Affordable Care Act, it's growing at about 1.4% per beneficiary. And when you take into consideration 57 million people get their health care from Medicare, that seems to be an objective, at least in the short term, that's been met. Would you disagree with that?
Yeah, well, I'll take a look at that issue.
Okay.
I have no doubt there may be some short-term effects on those
Let me just
changes.
throw something else out at you. And as you know, there's a lot of discussion in the air here about healthcare reform and new iterations of it. And Democrats and Republicans are always going to disagree the extent to which government should be involved. And that's a fair public disagreement and argument. But the fact of the matter is, the United States government is a massive provider of health coverage for people. 57 million people under the Medicare program, 70 million people under the Medicaid program, 28 million under the Veterans program. That's a lot of leverage. That's a lot of leverage to drive down the cost not only of prescription drugs, because you're buying medical services generally. So driving down that cost and driving up the quality of that care. And it seems to me that the federal government should be a lot wiser in using the leverage that it has, that it seems to just defer to private insurance companies that really screw people. You know, their business model is to jack up premiums and to reduce the payouts. So any thoughts on a bipartisan effort to recognize the strength that we do have in the federal government by purchasing not only prescription drugs, but also medical services generally toward the goal of reducing costs, increasing quality, and addressing this fundamental issue that you point to in your assessment?
Yes, I mean, I think that area has a lot of potential merit. There has been a shift recently by the Congress to make a move to not pay for quantity of services, but to pay for quality of services. And CMS is in the early stages of trying to figure out how they could change the payment programs to emphasize quality and hopefully reduce costs, but get away from the quantity benefits. And I think that has promise, but it's very early in the implementation of that change.
The gentleman's time has expired. The gentleman from New York, Mr. Faso, is recognized for 5 minutes.
Madam Chairman, thank you. And I thank you and Mr. Palmer for the idea of bringing the Comptroller General here before the committee to discuss this very important topic. Listening to your testimony and reading through a number of the pages of your written testimony, questions strikes me. Do our agencies, particularly the IRS and CMS, do they have the technological capacity to truly address the question of improper payments? And have you examined that issue thoroughly?
Yes, I'm very concerned. In fact, in 2015, I labeled information technology and acquisitions across the federal government a high-risk area. Most of the $80 billion that the federal government spends every year on IT services, almost 75% of it goes to support legacy systems that are in place, old systems. And that percent's been growing, which means we're investing less proportionally in new technology and new investments. I mean, we took a look lately at the oldest systems in the federal government. There's a couple of them at VA are over 50 years old. You know, DOD's still using one system operating off a floppy disk. I mean, so there's need for more technology.
Could you, Comptroller General, could you, for the record, supply the committee with an analysis of this, your current best thinking of your agency on this topic, and something that we could consider. On the topic, you mentioned EITC has been subject to discussion here. Let me just relate to you a meeting I had with a CPA in my district over the recent break, and he related that he believes there's massive fraud in the EITC. He related a current situation where a couple came to him, and the gentleman made $60,000 a year. The woman made about $12,000 a year. There were 2 or 3 kids in the household. They requested that the couple were not married, and EITC, as I understand it, requires a household income as a determination for eligibility. And they specifically said they want you to put on the IRS return for the man a separate address from where he actually lives. And he said this is rampant. He said he refused to do it. And he said the value of the EITC to this woman would be about $14,000 cash. And he refused to do it. They went to one of the nationally known income tax preparers, and he said he's certain that they got the EITC payment with an improper address. Does the IRS have the capacity to truly check the addresses of people, and should a EITC be subject to a pre-audit, which you alluded to also in your testimony?
Yes, it definitely should be. The other issue that we've identified, we sent undercover teams into 19 paid tax preparers with different tax scenarios. Only 2 of the 19 gave us the right answers out of that approach. And as I mentioned...
On EITC?
Not
Or on
on
anything?
EITC, on anything.
Okay.
All right? On EITC, though, IRS records show that there are more errors made by people who use tax preparers for this refundable tax credit than people who prepare their returns themselves.
And who are the unenrolled tax preparers that you mentioned earlier in your testimony?
It'll be some of the change that are in place. The ones that are enrolled are usually with tax practices of public accounting.
So
firms
would
and
we
others.
be better to restrict the EITC to only those who have the return prepared by an enrolled tax preparer?
Or I don't know if there's enough capacity to do that, but if not, what we've recommended, and the IRS actually implemented our recommendation, to have certification and training requirements of these unenrolled tax preparers, but the courts ruled they didn't have the legal authority. So we've recommended Congress give them legal authority to do it.
One last question. You mentioned SNAP, and I'm interested in this as I serve on the Agriculture Committee and the Nutrition Subcommittee, and we have to do the Farm Bill next year. You mentioned improper payments of over $3 billion in SNAP. Could you just briefly describe those?
Yeah, that was what they reported in 2015. They did not report any estimate in 2016 because they became concerned about the quality of the information at some of the state levels. And so I'm trying to delve into it and find out exactly what's wrong, which leads me to believe that maybe some of the prior estimates weren't entirely accurate.
Thank you so much, and I'd like it if you could give us some more information on SNAP, and I yield back. Thank you, Madam Chairman.
We will do that.
The gentleman yields back. I now recognize for 5 minutes the gentleman from Pennsylvania, Mr. Smucker.
Thank you, Madam Chair. Good morning, General.
Morning.
Having a little trouble wrapping my head around the idea that agencies can identify improper payments after the fact, but not before. So I guess, could you just explain to me a little more what exactly the improper payments estimate is? Is it based on actual findings of improper payments that have been made, or is it an estimate based on some other way of achieving that estimate?
Yeah, in most cases, it's an estimate that's made, an after-the-fact estimate where they draw a statistical sample. Let's say, for example, in Medicare, they'll pull a statistical sample of claims, and then they'll ask for all the documentation and examine the claim after the fact. A lot of these payments are made without documentation being submitted, other than a provider number or whatever, because in Medicare, there's over 1 billion claims paid every year by over 1 million different providers. And so the volume of activity wouldn't, unless you're using technology and you have it properly with good screening. So they're made based on that. And so, and like in the case of Medicare.
I'm sorry.
Yeah, go ahead, please.
So in your estimate, how much of the improper payment in Medicare and Medicaid, for instance, which you identified as the two largest
Right.
source of improper payment, how much of that could be stopped by stronger controls before the payment is made?
I think a significant amount. I can't give you a specific number, but I think it would be the only way to recover, I mean, to prevent these things from happening in the first place. So that's where we're trying to move the agencies to.
Yeah, it seems to me that'd be a place of great opportunity if we
Yes,
can.
and I've joined recently with a group of private sector providers that are working with the government to identify new technological ways to address this issue. So I'm hopeful that we'll get some good ideas from the private sector to be able to implement in the government programs.
All right, but change the subject only briefly.
Sure.
And I want to ask you a question that I've been asking others and trying to get a good answer to. You mentioned the long-term economic picture, or the fiscal picture, and the deficits and the growing debt, which I share your concern for that. In 2016, the economic growth rate slowed to 1.6%. What is the impact of that economic growth rate on our national debt projection?
Well, it has an impact. I'm sure CBO is, I mean, that's really the area that they focus on, has some way of calculating the impact of it. But the point I would make is that this problem that we have right now is so big, we'll never grow our way out of it.
Yeah, how much would that impact? So I think CBO right now is forecasting a 1.9% growth rate over the next 10 years. If we were able to move that, for instance, through tax policy, whatever it may be, to an average of closer to 3%, how would that change over that 10-year period our economic picture?
Yeah, well, it definitely would improve it. I'd have to go back and give you a more detailed answer after we would do it, and whether or not CBO has all the models. We don't duplicate what they do. We use what they do. So they would have the models to answer that question for you.
Yeah, but you believe it would have a significant impact?
I believe it will have an impact, yeah, but it depends on what you do on the spending side. If the spending side's going to keep going up.
Okay,
I mean,
sure.
that's the issue, and interest on the debt's going to keep going up. So you can have economic growth and get some additional revenues, but you already have a structural imbalance between revenues and spending. So you may, through economic growth, you may catch up a little bit, but it's not going to be enough as long as spending's growing faster than the economy's growing.
Yeah.
And right now it is.
Yeah. Okay, thank you. I yield back.
The gentleman yields back. I now recognize the gentle lady from Washington, Ms. Jayapal.
Thank you so much, Mr. Chairwoman, Ms. Chairwoman, and thank you for your testimony, Mr. Dodaro. I'm sorry I missed the last few minutes of this hearing for other votes. I wanted to go back to something you said at the very beginning when you were talking about a fiscal plan and the recommendation around a fiscal plan. And our distinguished ranking member, Mr. Yarmuth, spoke also about the president's comments on a shutdown. And I wanted to ask you about the necessity of being able to plan and the specific fiscal impacts of not being able to plan, not being able to purchase in bulk, not being able to actually bring about efficiencies that might come about when you can do that kind of planning. The appropriations work for 2017 was nearly complete last December, when then President-elect Trump convinced congressional Republicans to instead pass a long-term continuing resolution through April, 7 months into the fiscal year. Continuing resolutions, in my view, disrupt agency operations. People have told us over and over again they can't start new projects, they can't implement any kind of planning that has any sort of certainty, and funding ends up being misallocated based on previous year requirements. Can you comment on how a breakdown, this kind of breakdown in the appropriations process, has hurt the efficient administration of vital government services, and specifically on both the lack of an overall plan, but also the lack of ability on a regular basis to approve a budget and to not rely on continuing resolutions?
Continuing resolutions have been a problem for years. Only 3 times in the last 28 years have part of the federal government not operated on a continuing resolution. Some short-term, some longer-term. They disrupt hiring, contracting, orderly planning practices, and they also compress spending, because when you do receive the final appropriation for the year, as in this particular case this year, there's only a few months left in the end of the fiscal year. So it suppresses things earlier and compresses things later. It's a problem. You know, I've told the appropriation committees when I testify about GAO's own appropriation, one of the things I never aspired to be in the federal government is an expert managing under continuing resolutions. I mean, it's a problem in that area. Now, the fiscal plan, not having a fiscal plan there, you know, Congress, you know, we have this debt ceiling was never intended to control the debt, and it doesn't control the debt. All it does is authorize Treasury to pay the bills that Congress has already authorized. So there is no upfront decision Congress makes about how much do we want to have in national debt as a percent of gross domestic product. You know, in the European Union, they say 60%. You know, and states set different levels of how much debt they want to have. But the federal government doesn't do that. So I've recommended that we change the debt ceiling approach, because the way we're doing it right now, when there's a debt ceiling impasse, actually the markets have adjusted to this, so they're avoiding Treasury securities that would occur during a debt impasse period, and the federal government's paying more money. During the 2013 debt impasse and the government shutdown period, we estimate between $38 and $70 billion was paid in additional interest costs just because people were nervous we weren't going to pay our debts in time. I can't emphasize how important the full faith and credit of the federal government is to the effective functioning of our country and our nation. And I believe we need a better, not only a fiscal plan, but a better way to manage our overall debt, to make conscious decisions at the time revenue and spending decisions are made up front. So we need much more fiscal discipline in our approach, both on the annual basis, but also the long term.
Well, you actually went right into my next question, which was about the debt ceiling, and you mentioned specifically that your analysis says that the brinksmanship around using the debt limit increase and the impasses that we get to actually hurt us substantially, $38 to $70 million. Is there a reason to think that these costs might be higher later this year if we delay action on the debt limit until Treasury approaches the limit of the extraordinary measures, and what would that be?
Yes, well, it depends on how long it would be, but I think, number one, Congress should pass the debt ceiling limit on time, so there's not concern about whether or not the federal government's going to pay its bills on time. Right now, I mean, last time this occurred, Standard & Poor's reduced our sovereign credit rating, and it's still lower than the top. Moody's and Fitch have us still at the top. All 3 bond raters have expressed concerns about the credit risk that we have from our debt burden. And they're concerned, and they've said in some cases if that debt burden continues to increase, that will lower the federal government's credit rating, which will raise interest rates and costs and alarm investors. What we found is that based on the global financial crisis and lessons learned out of that, but also this debt impasse thing, that investors in Treasury securities already have contingency plans to not buy these investments that might mature around a debt impasse ceiling. And that's depressing the Treasury securities market, so we're paying additional interest costs, but it's affecting liquidity in the secondary markets because Treasuries are used to trade for financial capital. So not only are we paying more, we're distorting the markets by not having a rational process for approach to authorize this debt to be paid in a timely manner. I'm very concerned that we never do anything to affect the full faith and credit of the federal government.
Excellent advice. Thank you, and I yield back.
The gentlelady yields back. The gentleman from Georgia, Mr. Ferguson, is recognized for 5 minutes.
Madam Chairwoman, thank you so much, and to the Comptroller General, thank you for being here today. This has been incredibly helpful to listen to not only the questions that have been answered or asked by both sides, but also your answers, and I thank you for your candor in delivering those. One of the things that I look at, and we've looked at on the Budget Committee, is looking at the growing size of mandatory spending. And I think that we would all agree that as we approach the next 12 to 15 years and we look at that number moving from somewhere close to 70% to over 80%, would you agree that we're going to be very limited in our ability to meet our obligations, the promises that have been made, particularly related to Social Security, Medicare, and Medicaid?
Yeah, definitely. I mean, this situation will limit the flexibility, not only to deal with known problems in mandatory spending. There are some fiscal exposures. The Pension Benefit Guaranty Corporation, $74 billion liabilities exceed their assets. The multi-employer pension fund is expected to go insolvent in 2025. These things aren't even included in the estimates that I've given you about the long-term fiscal exposure. Fannie Mae and Freddie Mac are still under federal conservatorship. Since the global financial crisis, the federal government's been either directly or indirectly insuring about 2/3 of all single-family mortgages. And so if there's a downturn in the housing economy, the risk will accrue to the federal government. That's not considered in these costs. So you're absolutely right. They're mandatory programs, but there are other fiscal exposures. And the more we borrow, the less flexibility we'll have later on to deal with these situations.
To that point, I think we are fast approaching an environment where we simply cannot cut our way out of a program, we cannot spend our way out of a program, we cannot simply reform our way out of a program. We're going to reach the point where we have to have a very honest conversation with ourselves, but most importantly with the American people about where these programs are. One of the reasons that I was so glad to have this particular meeting is that I think before we go into a discussion about Social Security and Medicare, I think we owe it to the American public to do everything that we can to make sure that we are spending every dime as wisely as we can, getting rid of the waste, the wrongful payments, the fraud. Whether it's intentional or unintentional, we have to be good stewards of the money. And so I thank you for your time here. I have one final question. And do you believe that the processes that we followed on budgeting and appropriations, let's say for the last decade, and even our current omnibus and appropriations bill, does that mechanism address the spending reforms needed to actually get at deficit reduction?
No.
Okay, thank you. Madam Chairman, I yield back.
The gentleman yields back. I now recognize Mr. Westerman from Arkansas for 5 minutes.
Thank you, Madam Chairman, and thank you, Mr. Dodaro, for being here today and for your very insightful comments and for the report that you provided to us. Having served in a state legislature before I came here, I first started reading about improper payments through a GAO report that was done around 2010 or 2011 on Medicaid payments. So we did a little audit back in my state to see if we could find any improper payments in the Medicaid system, and sure enough, our state auditors found that there were improper payments in our Medicaid system, pretty much in line with the numbers that the GAO had projected. But I also learned something very interesting about Medicaid, because it is a federal match program, that there's really not a lot of incentive in states to stop the improper payments. You could almost, I hate to say this, but look at it where it's viewed as economic development, where you put a small percentage of state dollars in and you get a large percentage of federal dollars flowing into the state. So I'm a proponent of block grant type of funding, but do you see other ways that we could address the Medicaid system to put more incentive in the states to stop these improper payments?
Yes, there are two ways. One, we've made a number of recommendations for CMS to collect more information from the state. A good example of this is the federal government makes payments to the states for uncompensated care. These are, you know, if somebody goes in, they don't have insurance or whatever, but they don't base it on the actual uncompensated costs of hospitals. They base it based on Medicaid workload, which in this case, more people are being covered by Medicaid, so it's not a good proxy for uncompensated care. And when they go to make uncompensated care payments for Medicare, they don't even consider what they've already paid the state for Medicaid. So they need more information. This is a big problem. Number two, I've been working with the state auditors around the country and got about 37 state auditors to agree to do more work looking at the Medicaid area. They see, and they're independent, but CMS hadn't had a relationship with the state auditors. So I brought them together in a meeting along with OMB, and I've now connected that state audit community to the federal agency that has responsibility. They're meeting this month in South Carolina to talk more about what could be done by the state auditors. So those are two, you know, just good examples. Also, the state auditors need to audit more the managed care portion of Medicaid, not just the fee-for-service portion.
All right, we also set up a state office of Medicaid Inspector General that was out from under the Department of Human Services in the state, which had the program integrity layered underneath in a kind of a middle management role within, and that helped expose more of the waste fraud.
Yeah, you need to have an independent look.
So moving on to a different topic. Last year, our deficit was $587 billion, according to CBO. And the terminology we use around here is if we had zero deficit spending, we would have a balanced budget. But if we look at CBO's numbers last year, the debt actually increased over $1 trillion. So there's another approximately $500 billion that went towards debt that wasn't in the deficit. And it gets complicated, but it comes back to the debt limit and financing. And one of the CBO notes says debt subject to limit differs from gross federal debt mainly because most debt issued by agencies other than the Treasury and the Federal Financing Bank is excluded from the debt limit. That limit was most recently set at $18.4 trillion, but has been suspended through March 15, 2017. On March 16, 2017, the debt limit will be raised to its previous level, plus the amount of federal borrowing that occurred while the limit was suspended. CBO says that the gross federal debt is projected to rise $9.7 trillion over the next 10 years, or about $1 trillion per year. And I noticed you addressed the debt limit on page 14 of your report, and you said we recommend that decisions about giving Treasury the authority to borrow be made when decisions about spending and revenues are made, and you gave us about 3. Can you briefly tell us how that will help lower the debt if we move that decision point to when spending decisions are made?
Mm-hmm. Well, number one, it'll focus the attention of the Congress up front rather than just on the spending and the appropriations. In a way, you got to remember, you know, almost 2/3 of the federal government spending is on autopilot. It doesn't involve the appropriation process. The appropriation process only covers about 1/3 of the federal government's total spending. So other than the budget resolution process, there really isn't any definitive congressional focus on total federal government spending and total revenue that's expended, and how much of a deficit are we going to have to finance up front before that decision is made. So forcing that decision to be made up front will do it. Now, that alone won't solve the problem. I also think there needs to be a way to have a fiscal rule on how much debt that the federal government wants to occur over a period of time. There'd have to be exceptions for exigencies and other things that occur. But right now, there's not a conscious decision made about how much debt we want to have as a country. It just sort of happens as it happens, and you know, then there's the result. And I don't think that that's good fiscal discipline.
Thank you.
The gentleman's time has expired. The gentleman from Texas, Mr. Arrington, is now recognized for 5 minutes.
Thank you, Madam Chair and Comptroller General. Thank you for your time, and thank you for your clear and extremely sobering insight as we prepare to vote on this omnibus, but more importantly, because most of the freshmen, we showed up 100 days ago, really didn't have a lot of input into that, if any.
let me just say it another way. We had no input into that, and we will have input now going forward on this 2018 budget. And we're having really good discussions along the lines of what you've laid out and some of the things you've mentioned. And, you know, for me, I think this is the biggest threat to the future of our country. I think it's the biggest threat to my children's future. That's my acid test, is to uphold the Constitution and make this, or hand this country safer, stronger, and freer to my 6-year-old, 4-year-old, and 2-year-old. This is the one that keeps me up at night. And there's just, we can't have all the discussion that this deserves in the 5 minutes, but quantify for me, if you could, the implications of the interest rate risk. That is, if it moves up a percentage point, what's the impact?
Yeah, CBO estimates that a 1% increase in the interest rate over 10 years would add about $1.7 trillion to the debt. So, and the other point I'd make along this line here is we're very exposed because a lot of the borrowing is in short-term borrowing and bills and notes. So that borrowing has to be refinanced on a fairly regular basis. For example, last year there was $8 trillion in new financing, and that was to pay $7 trillion of debt that we had to refinance over a period of time, plus financing new debt that occurred during that period of time. So our interest rate exposure is very significant.
You know, when you look at this, and I don't think the American people fully appreciate the extent or the depth of the debt hole that we're in, and the spiral, the vicious cycle, and how we get out of it. It almost feels like mission impossible at times. But what's a meaningful but responsible, because we didn't get here overnight, or won't get out of it overnight, what's a meaningful way to get us on a path going forward? And mainly on the mandatory spending side, because we know those are the drivers, and we haven't touched it, and nobody wants to talk about it or do anything about it. But I hope our class especially, we invigorate the body here with the political courage to do something about it. So with that, tell me what's a reasonable and responsible reduction in spending on mandatory to get us to balance.
Right. I think there are two fundamental decisions. What does government want to do, and how do you want to pay for it, other than borrowing? All right. A good place to start, in my opinion, is the Social Security system. I issued a special report, which I'm glad to give this committee, last year, because the disability portion of the Social Security program was projected to go bankrupt last year. Now, the way that was solved was to just redirect some of the payroll taxes that were going into the old age portion of Social Security to the disability fund. But that only props it up for the next 6 years. By 2023, the disability fund will only have enough money to pay 89 cents on the dollar. By 2035, Social Security will only have 77 cents to pay on the dollar. And so there are known options for addressing the Social Security problem. We lay them all out in our report and give the pros and cons of the options. So I think that's there. Healthcare is a more difficult.
Let me push pause on that,
Sure.
if you don't mind. I got just a little time, real quick answer on this. I wasn't here, and I don't know if this was asked, but this omnibus that we were prepared to vote on, is that doing anything to get at the structural reforms and the spending reforms that you're recommending or that we're talking about here?
No.
Okay. Another thing that I hear a lot, because I'm new, and I had a year and a half to talk to folks in West Texas and listen to them, but this notion of Washington playing by a different set of rules. You said 10 agencies or more are below the 10% threshold, or above the 10%.
Above, right.
Tell me about that a little bit, and what can we do about it as members of Congress in this committee?
I think there ought to be more oversight hearings. I mean, there ought to be the agencies that are responsible for these overpayments here, either along with me or in lieu of me, to question them about what they're doing and to hold them responsible. Not just the lower level people. I think you got to hold the heads of the agencies responsible for this problem. It needs to be, the tone at the top needs to be set appropriately, and there needs to be focus on this, because if that leadership occurs, I believe you will see a drop in there, and if there's some potential consequences, other than a public hearing and the risk of embarrassment, there needs to be some decisions by the appropriators about, how we're going to allocate money if people aren't providing proper financial stewardship.
Thank you very much.
The gentleman's time has expired. The gentleman from Pennsylvania, or excuse me, the gentleman from Ohio, Mr. Renacci, is recognized for 5 minutes.
Thank you, Madam Chairman. I thank you for holding this hearing as well. I know we were looking at improper payments, but I was actually asking the previous chairman, to bring Mr. Dodaro before the Budget Committee, because I do think your insight is important, especially for people that are designing a budget. I thank you for being here as a father of 3 myself, and I know you and I have spoken many times. What I really loved about the first conversation you and I had, you said that you were in this to try and make sure we turn this country in the right fiscal direction. It's one of the reasons why I dropped the bill last cycle to bring you before the complete House and Senate. It was a resolution that got 160 co-sponsors, because I do believe the starting point should be you coming before the House and Senate and explaining our fiscal situation. So I'm going to continue to push for that resolution this year. In your testimony, you indicate we cannot continue to ignore the fiscal constraints facing our country. We have an obligation to our constituents and future generations of Americans to make tough decisions and put our fiscal house in order. You stated that the current debt as a share of the economy is the highest it has been since 1950, and under current law, the debt to GDP ratio is projected to exceed its historical high of 106% in the next 15 to 20 years. I was a businessman and a mayor of a city which had fiscal issues, and the first thing we did was we looked at our we drove everything based on our fiscal issues. So from a top line picture, would you agree that the current drivers of our debt are Medicaid, Medicare, Social Security, and interest on our debt?
Yes.
Okay. Would you also agree that these programs are unsustainable based on the current demographics in our country and the current program payouts?
Yes.
Thank you. And these drivers are growing rapidly each year, correct?
Yes.
If you were reporting to Congress and the American people your greatest fiscal concern for our nation, would you report that our spending is unsustainable?
I would say our fiscal condition is unsustainable because we're not generating enough revenue to meet the commitments that we have, and we either have to generate more revenue or cut spending. But that's a policy decision by the Congress. I would never advise Congress on what to do, but it's a spending and a revenue issue, my opinion.
Okay, and is our debt growth unsustainable as well?
Yes, definitely.
Okay, how much of our debt is held by foreign countries?
About 45%.
What happens if those countries decide they no longer want to lend this money to the United States?
We'll either have to pay probably higher interest rates to domestic savers, and we don't have a lot of domestic savings to begin with. And whatever the federal government takes up from domestic savings, that's less for capital investment for economic growth. So we'd be in trouble.
Yeah, and there's been a couple ideas driven out, which I realize, but let's talk about spending. You said the average we need to cut spending by is 25% on the average over the next 10 years. If today 70% of our spending is Medicare, Medicaid, Social Security, and interest, and you also said that's on autopilot, that leaves, and 15% is military and 15% is discretionary. If you cut 25%, I'm just looking at the spending side.
Right.
If you cut 25%, you would basically have to gut our military and gut every bit of discretionary spending because the 70% is on autopilot. So if it's just the spending side, would you agree with that?
Yeah. If you didn't change the mandatory programs, that's what you'd have to do.
Right.
Yeah.
So
and that's I wouldn't recommend that, but
no, I wouldn't recommend it either.
Yeah,
but it's kind of interesting because
Yeah,
if you're going to cut 25%, you cut everybody's salary here too.
But it shows the magnitude of the problem that we
Absolutely. Now, on the income side, the issue, and I realize that, I mean, I heard one of the members say, well, if you increase the Social Security payout, tax on the payout, the problem is you'd also be increasing the expense to the corporation because you would, that's 6.5% more expense to the corporation, which will slow their ability to grow as well. Would you agree?
Yes, it'd have implications, and particularly the only way it would help solve the problem is if you delink it to their benefits. So if their benefits didn't rise based on their payments, and that would have other consequences for people as well.
Sure. So I want to look, we went to the expense side, which is kind of drastic to fix this. On the income side, we also have the highest corporate tax rate in the world. Would you agree with that?
On a statutory basis, not necessarily on an effective tax rate basis.
So, but corporations are leaving and going overseas because they can get a lower corporate rate. So we're losing businesses to overseas markets.
Yeah, well, that's a problem, but our studies show that the effective tax rate, after all the tax expenditures are in place, on average is about 14%.
Okay, so again, the real key here is, and I agree, it's got to be a mix of expenses, and probably have to look at some issues with our tax rate. But in the end, we would, and I'm just hoping we can get to the bottom of this. I mean, our spending is out of control, our debt's out of control, and we have 70% of our spending which is on autopilot. Interest rates, I heard, if it just goes up 1 percentage point, our debt increases $1.6 trillion over 10 years. I sure hope the Congress members are listening today, because these are the issues that we face every day. So I thank you again for being here, and Madam Chairman, I yield back and thank you for having this hearing.
Gentleman yields back. The gentlelady from Texas, Ms. Sheila Jackson-Lee, is recognized for 5 minutes.
I thank the chairman and the ranking member, and Mr. Dodaro, I thank you for the years of service that you've given. It is a privilege to serve on the Budget Committee with my colleagues, and I get a chance to see the gentleman who's behind so many good studies that come before our committees on responsible management. And I want to make sure that I put in the record that the essential agency, this agency, to support the fiscal management of agencies, and you carry out audits, evaluative and investigative assignments to provide legal analysis for the Congress, which I think is very important. I think another important element of your work, of course, is that you deal with the issue of audited financial statements, and that we raise a concern about ensuring that our agencies can get to that point, that they can do that. But more importantly, you have found that the consolidated financial statements for fiscal year 2016-2015 indicate that the federal government must make more strides in improving federal financial management. But to say all that is to say that we also have to have the dollars, the balanced dollars, to be able to be fiscally responsible. And I think that that is something that I want to pursue in a line of questioning. We're in tax season, and there are a number of proposals. One in particular that has come forward that has a list of eliminating the AMT, eliminating estate tax, and the calculated number is about $2 trillion in debt or deficit will be increased. So my question is, the biggest tax cut a person could receive is not paying any federal income taxes at all. That is, of course, under the jurisdiction of the IRS. In your 40 years of experience at GAO, have you come across any evidence that when a person avoids paying taxes for 20 years, they are helping the economy, and their tax avoidance activities, some would say tax avoidance festivities, actually pay for themselves? So that when individuals don't pay their taxes, and if someone has not paid it for 20 years, that it actually pays for itself.
I'm not sure in terms of an individual, on an individual basis.
It could be a
Yeah,
corporation.
if it's a
or
corporation, whatever.
person
I mean,
of wealth.
yeah, well, they're definitely not in compliance with the law, and it's not helping fund the federal government, so they're not fulfilling their legal responsibilities. And therefore, it's not helping anyone other than themselves.
Another quick question. Can the IRS, in your perception now, adequately address tax compliance without additional staff? And will the tax gap widen if we continue to cut IRS staff, actual staff?
Yeah, well, I think the record's pretty clear. If you add additional resources to the IRS, they'll produce additional revenue. We've made a lot of recommendations, though, too, that they could do more with the revenue that they have to have a better comprehensive plan. And I would recommend that the Congress, if they decide to make a policy decision to give them additional money, they also require them to produce greater return on the investment that's made and show that they are pursuing the best comprehensive strategy to use their resources in a constrained budget environment.
Thank you so very much. Let me further ask, isn't receiving an emolument of the type prohibited under the Constitution the worst of improper payment, and does not an emolument have far greater potential to corrode our democratic system of governance than working-class taxpayer who may be overpaid a few $100s under the Earned Income Tax Credit.
Yeah, we've not done any work, as I recall, on emolument issue. I'll go back and check, and if we have something, I'll submit it for the record.
And I appreciate it, and I'm going to make an official request, and I will put it in writing, that I'd ask the GAO to make that assessment, because I think it's important when you look at the balance between what the Earned Income Tax Credit does for a working family or single person, as well as how it impacts on the emolument. We're in the midst of debating health care, and so one of the questions is the loss of insurance for 24 million people. Can you comment on how the breakdown in appropriations process has hurt taxpayers, meaning that we do not do it, and we're in the CR, hurt taxpayers and programs, beneficiaries like the 24 million who now receive available, accessible quality health care through the Affordable Care Act, who depend upon the efficient administration of vital government services?
Yeah. Well, there needs to be, final decisions made by the Congress on how they're going to handle those issues. I mean, the continuing resolution process, if that's what you're referring to, really affects the functioning of the agencies, and it debilitates their hiring approach and working with contractors, and it also requires them to make compressed spending decisions about the money once the appropriations of available at the end of the year. So it is disruptive to the agency operations. Now, how that translates into impacts on individual people, American citizens, varies from program to program.
Might I say that it might also impact upon their audited financial statements or their ability to put financial statements together when we have a disruptive appropriations process and cannot fund the government in a way that it can plan.
It's definitely not a best practice.
The gentlelady's time has
I
expired.
thank the gentlelady.
The gentleman from Alabama, Mr. Palmer, you're recognized for 5 minutes.
Thank you, Madam Chairman. I just want to address the issue of delinquent taxes for just a moment, if I may, and point out that it's reported in 2015 that there was $3.5 billion owed to the federal government by federal workers. 3.1% of the federal workforce had not paid their taxes, including a number of key officials within the Obama administration. There was a bill introduced in 2015 that would have given agency directors the ability to take action against federal workers, federal employees who did not pay their taxes, and our colleagues across the aisle would not support it. There was a Senate bill to block bonuses for people who failed to pay their taxes, and that bill also failed. Now, to get back to the topic at hand and the improper payments, I thank you for coming here, and you've been enormously helpful. I'm very grateful for the work you and the GAO have done on this. I want to talk about a couple things. One, to try to put this in perspective, there are 4 programs, actually 2, and one of which has 3 subsets, that being Medicare, that account for $96 billion in improper payments. And just for a point of reference, I want to point out that the entire Department of Education it was funded at $69.2 billion. Department of Labor at $12.2 billion. I mean, those 2 departments together are less than what we sent out in improper payments. So this is a huge problem. I appreciate what was done in the previous administration and their efforts to try to stop the improper payments, but I think we've got to take this very seriously. And I've got a slide. It's actually from your testimony and from a previous meeting that we've had with the Subcommittee on Intergovernmental Affairs at OGR and with this committee as well. And I just want to point out that in terms of where the problem lies, it's really due diligence. You've got 56.5% of the problem in terms of due diligence that's insufficient documentation, inability to authenticate eligibility, and the failure to verify data. 56.5%. That's low-hanging fruit. We ought to be able to stop that. That would account for $75.5 billion. Okay? And then you mentioned problems with data systems, outdated technology, that sort of thing. I think that falls under the administrative or process errors at both at the state, local, other parties, and federal level. That accounts for another 33.8%. That's a little tougher to solve. I think that's going to require some outlays from the federal government to improve their data systems, but that accounts for $45.2 billion. I think the savings more than justify whatever it might cost us to upgrade our data systems. Would you agree with that?
Definitely, definitely, if properly managed,
Well, that gets back to the due diligence part.
Yeah, right.
I can't understand why we haven't had some enforcement effort on the agencies, particularly the ones who have the bigger numbers, and with the 18 programs that failed to report. We have got to take this seriously, because I've made this point several times that when we look at the dollars that are going out, the $133.7 billion, that's not all that's going out. I think just top of my head estimate, we're paying about 2.8% interest. So
That's about right.
About
average,
right.
On average.
So you add that to the dollars that are going out improperly, and that adds another $3.7 billion. So, Madam Chairman, I just think this is a critical issue for us. I think it helps us in terms of finding a pathway to balancing the budget if we can just stop sending out the money. I've had some people say, well, how do you recover? I'd love to be able to recover the money, but right now I'd be quite happy if we just stopped it. Again, General Dodaro, I thank you for this outstanding work. I would encourage my colleagues on the committee to take a look at that slide. It's in your binder on page 28 in the General's testimony. And we need to start working on a way to have the program directors do the due diligence to make sure we stop improper payments. I yield back.
The gentleman yields back, and I want to say that at the beginning I gave you recognition for bringing this issue to our forefront, and we really appreciate that. I now recognize the gentleman from Ohio, Mr. Johnson, for 5 minutes.
Thank you, Madam Chair. Thank you for joining us today. I appreciate it. GAO's long-term budget projections indicate that absent some policy changes, the federal government's debt held by the public as a share of GDP is expected to rise steadily from today's already high level of 77%. It'll surpass its historical high of 106% in 15 years under GAO's alternative simulation, and in 25 years under GAO's baseline simulation. The debt to GDP ratio would continue to escalate at an ever-increasing rate in subsequent years under both scenarios. GAO writes that this compares to an average of 44% since 1946. As I understand it, the GAO report, recent CBO long-term budget outlook reports, and the fiscal year 2016 financial report of the United States all conclude that the federal government's fiscal path is unsustainable. Do I have this correct?
Yes, you do.
Can you elaborate on what this unsustainable fiscal path could mean for our country and the American people? Could this debt path eventually lead to a fiscal crisis in which borrowing rates rise sharply? And if so, how soon might this occur?
This definitely has a lot of different impacts on the country and the American people. None of them good. None of them good. That's a good summary. What they include are higher interest rates that the federal government will have to pay to service this debt. So you have, right now, in 2016, there were over $250 billion in interest that we were already paying on the federal government to service this debt. That will continue to compound and grow up the more debt we have and the more interest rates go up over a period of time. That means that there's going to be more pressure on the rest of the federal government's budget that could ultimately impact the types of decisions Congress makes about what programs to fund, what benefits to provide, what services to authorize. It will also potentially affect our credit rating. I mentioned earlier that all the bond raters believe our existing debt burden is already a credit weakness in our profile, and one has reduced our credit rating from the top credit rating, and that, if it impacts our credit rating in the future, that'll affect not only our interest costs, but borrowing. It will also enormously affect the flexibility of the Congress to deal with problems, the known problems that will occur, Social Security program, Medicare program, for example. The pension benefit guarantee program is going to be a problem. Flood insurance is already not actuarially sound and owes over $23 billion to the federal government, and that's unlikely to be repaid. So there are enormous implications. Over the long range, it could reduce national savings and income that would have deleterious effects to the economy as well.
Like we said, none of them good.
That's right.
Does this debt trajectory that GAO projects emphasize the need for putting in place policies as soon as possible that would arrest this trend and lower debt levels over time? And do you have any ideas of what some of those policies might be?
Yeah, well, definitely the sooner the Congress takes action to put a plan together, the better. These things will accrue over time. If we stop the compound interest on our debt, that will help a lot there in that area. So the exact policies that the Congress wants to follow, that's up to the Congress to decide. That's not, a role for the GAO. Our role is to say, you have a problem, you need to deal with the problem. The sooner you deal with it, the better, because the longer you wait, as you mentioned earlier, none of the options are good, but the longer you wait, the more difficult and more draconian those options become in order to deal with the problem. One of the most difficult parts of my job is to try to get people to take action before it becomes a crisis. So I'm here today to tell you, if you start taking action, this will avoid a potential crisis down the road.
You sound a little bit like that commercial.
Yeah, pay me now or pay me later.
I'm not a guard. I'm just a robbery monitor. There's a robbery. So I, for one, would.
I'm not elected. You are.
And I appreciate that. And you're right. It is Congress's responsibility. But as people might assume, we don't hold the corner market on all the good ideas. And if you have some, I, for one, would love to hear what they are. And with that, I yield back.
The gentleman yields back. I just want to clarify for the record one question that was asked by Mr. McClintock earlier on the level of federal revenues compared to the historical average. And the staff reminds me, according to page 2 of the Congressional Budget Office's January 2017 baseline report, the budget and economic outlook for 2017 to 2027, and I'll quote, it says, if current laws generally remain unchanged, revenues would rise from 17.8% of GDP in 2017 to 18.4% by 2027. They have averaged about 17.4% of the GDP over the last 50 years. So according to the CBO's current law baseline, federal revenues as a percent of GDP are projected to be higher than the 50-year historical average, both this year and over the budget window. And I think it just once again says that no matter how much we grow our revenue, if we don't get our spending under control, the revenue won't matter if we just keep spending more than what we bring in day after day after day and year after year after year. So, Mr. Dodaro and your staff, all the workers in your office, I just want to say a big thank you for the work you do. You've given us such great information that have enlightened us, given us some instructions on how we can control this path that we're going down right now. I only wish that I could have all 435 members of Congress hearing what you're saying in here, and I'm going to recommend, at least to my conference, that that they listen to this hearing and that they read the information that you put out, because it is such helpful information. First, we have to know it, and then we have to take charge of it and make sure that we put those policies in place. And then I think finally we've got to hold people accountable for the policies you put in place, because obviously they're no good unless you do hold people accountable. You can put the ideas out there, the recommendations, but there's got to be accountability at the end of the day. So I thank you. I thank Ms. Jayapal for sitting in for the ranking member and being here with me during the hearing. I want to be advise that members may submit written questions to be answered later in writing, and those questions and your answers will be made part of the formal hearing record. Any members who wish to submit questions or any extraneous materials for the record may do so within 7 days. So all of those ghosts that are sitting here hear that. With that, the committee stands adjourned.
Thank you.